Chapter 1, Phlebotomy Practice and Quality Assessment. This is the first chapter we will introduce for the Phlebotomy Handbook. I will go through the slides, and if there is additional information, I will stop on the slide and provide that information to you. If it is a slide that just requires you to read, I will instruct you to please read the slide and I will continue on with the presentation. Chapter objectives. Every PowerPoint going forward will have a set of chapter objectives, key things in it that we will address throughout this chapter. Phlebotomy practice and definition. Clinical decisions are based on standards of practice, diagnostic testing, patient history, and observation of signs and symptoms. Standards of practice vary greatly between the different areas of the medical field. We will go over standards of practice for phlebotomy in class. A patient's history. For example, if you were supposed to come into the lab fasting, patient's history could also be things that we address prior to seeing the patient. So for example, a patient that is hard of hearing is going to have a patient history that impacts our ability to communicate with them. So those are some key things that we gotta take into consideration and make sure to aid our patients to the best of our ability. Observations of signs and symptoms. This is seen during our procedure with the patient, especially if the patient were to become faint. We might notice that they become flushed, pale, also might tell us that they're not feeling well. So those are things that we got to take into consideration. Those are signs and symptoms that a patient might display. They might slump forward. Observations of signs and symptoms as well. If you notice the patient, if we were to hit an artery or a nerve, patient might feel what's called an electrocuting pain and pull back their arm. So we need to be aware of the nonverbal as well as the verbal when we observe signs and symptoms. The other thing too, signs and symptoms help doctors make a diagnosis. So a patient might come in feeling very fatigued, tired. Those are symptoms that they got to give the doctor in order to make a clinical decision. Clinical laboratory test results are performed primarily on blood specimens. It gives an indication of abnormalities inside the body, and it helps healthcare providers in clinical decision making. Overall, clinical laboratory test results give us the ability to understand what's going on internally with the patient, because sometimes the symptoms do not display what's actually going on with the patient at all times. Definition of phlebotomy, derived from the Greek word phlebo, which relates to vein, anatomy, which relates to cutting. Definition can be summarized, as we can see in your textbook on page 2, which relates to cutting. In ancient times, phlebotomy was practiced in withdrawing blood using various means, including knives, crude lancets, leeches, blood cups, and bowls. And I will go over this more in class. Most common phlebotomy techniques. The venipuncture technique is the withdrawal of venous blood sample using a needle attached to an evacuated tube system or other collection device. Skin puncture capillary technique is puncturing the finger with specifically designed safety lancet to withdraw a smaller amount of capillary blood. Also, too, heel sticks performed on babies would be part of our skin puncture procedures. How are laboratory test results used in clinical decisions? 1 would be diagnostic and screening tests. Are these abnormalities or medical conditions affecting the patient? 2, therapeutic assessment. Is the correct treatment or therapy being utilized? And 3, monitoring. Is the treatment or therapy effective? For example, for 2, when we put patients on a IV antibiotic, We want to make sure that is the correct treatment and it is actually treating the illness. Monitoring. We're going to monitor to make sure that there is no abnormalities with the drug or side effects. Sometimes a drug, how it's metabolized might change, so we might have to adjust the dosage. So we're going to continue to monitor those patients to make sure the drugs are, again, working correctly or using that therapeutic assessment. Please read this next slide. I just want to reference Box 1.1 in your textbook for potential job sites for phlebotomists. Again, I want you to just read this slide and know the members of your healthcare team. We work with several doctors, nurses, medical assistants, and this figure 1.1 just kind of gives you an idea of how these healthcare professionals work together to treat a patient. Clinical pathology, blood and other types of bodily fluids and some tissues are analyzed. Examples of this, as we see in your textbook on page 7, could also include tissues, urine, cerebrospinal fluid, sputum, gastric secretions, and synovial fluid. Again, this slide I'm going to have you read on your own. Figure 1/3, the clinical laboratory workflow pathway. I want to stop here to really focus in on this. Pre-examination process is what happens before testing. This I summarize as the phlebotomist. Examples include laboratory examination requests, collection of the specimen, labeling the specimen, post-puncture care, and transporting the specimen. Also sometimes processing the specimen prior to going to the lab. Examination process, using the appropriate testing methods. This is what happens during testing, so this is our medical technologist. So using appropriate equipment, performing quality control, reviewing and verifying results, interpreting other information that correlates with the test results. And then post-examination, what happens after testing, this is reporting the final test results, entering critical laboratory data, storing specimens appropriately. Please make sure to go over this in detail, as this is continually brought up throughout the semester. We always look at our pre-examination, examination, and post-examination as part of our workflow pathway. This slide I would like you to read over. We performed this case study in class, so I'm going to go ahead and skip it. Clinical laboratory workflow. All steps in each of these domains must be done according to standards of practice and must be traceable to the individuals who perform these tasks. What is the standard of practice? As we can see in our textbook, standard of practice is going to vary depending upon the area you work in. So the standards of practice for phlebotomists is going to be very different from the standards of practice for nurses or medical lab technicians. We really want to look at two when we talk about standard of practice. Even if we are qualified, for example, I'm a licensed EMT, I can't perform those duties when I'm working as a phlebotomist. So these are procedural guidelines set by the governmental accreditation certification agencies, professional organizations, and our manufacturing and equipment requirements. So we have a set standard of practice that we need to perform for our particular job site. What is traceable? Traceable is being able to track our specimens from the time of the pre-examination when we draw our patients to post-examination. And I'm going to give an example of this in class. Again, this slide I'm going to have you review. Agencies that oversee the clinical laboratory. Phlebotomy education and certification. High school diploma or equivalent is required. Length of training ranges from a few weeks to months, and you need to pass the national certification exam, which Harvard College prepares you for in Phlebotomy 102. You can attend continuing education programs online or through colleges and universities. These next couple slides I'm going to have you read on your own. Just be aware that a career entry phlebotomist should have fundamental knowledge of the following. The 4 categories of professionalism, growth, respect, support, and service, as shown in Figure 1/4, is essential for phlebotomists. And this kind of goes over those categories in more detail. The one thing I want to kind of focus in on is respect for tolerance of differences and effective communication. It is key that we do our best to effectively communicate to our patients. Sometimes we have communication barriers, which we will cover in Chapter 2, but being able to get past those barriers and not let it impact our ability to provide great customer service to our patients. Again, please read this slide. Tips to relieve and reduce stress. We will be doing an activity in class. I just want you to be mindful of taking time for yourself. And also too, if we can, we control the source of the stress by either stepping away if we can, or reducing that stress by asking for help. Ethical standards for phlebotomists: do no harm intentionally, perform according to sound technical ability and good judgment, respect patients' rights, confidentiality, privacy, right to know about their treatment, and right to refuse. A patient has the right to know about their treatment, so if they were to ask you, why am I having my blood drawn, we have a standard of practice. We can only give so much information. So the example, if you have a patient that comes in that asks, well, what labs am I having done? You can tell them what the lab is and give a basic overview of it, but we cannot determine why the doctor is performing that particular test. So what I tell my students to say is, if you'd like more information, I can get your nurse or get your doctor. And they do have the right to refuse treatment. They can decide that they don't want their blood drawn, and we have to basically just document the situation, notify the nursing staff, and then continue on from there. We cannot restrain a patient to obtain a sample. That is going back to do no harm intentionally. Again, I'm going to have you review this slide on your own. So quality healthcare has 3 major components: efficacy, as we can see here, and also documented in your textbook, is on page 23. The healthcare services provided have a positive impact on the patient's health, and that the patient improves or gets well. What is appropriateness? The procedure performed on the patient are the correct ones for that particular condition or illness. And what is caring function? The services provided to patient are available, timely, effective, safe, efficient, respectful, and service to the patient's needs. We want to be aware that appropriateness, i.e., performing the correct surgery on the right side, and caring function, making sure that we don't have our patients waiting a long time in order to get their labs, and that we're available when we say we're going to be. Our number 1 is going to be external stakeholders, and number 2 is going to be internal stakeholders. External stakeholders are outside the organization, internal stakeholders are within the organization. And this is it for part 1 of Chapter 1. Please view part 2 to finish Chapter 1.